Starting to pour in. We've had really an amazing response here with this webinar. It's an understatement to say I'm excited to talk about all of this and to definitely join the stage here with Jason Brightwell. I think we can kind of get started here. People will start to kind of pour in. Let me kind of go over to my slides. Hopefully everybody can see this. Please know that we do have people monitoring this as well, and we have the chat. So if there are questions, please feel free to begin to ask your questions. You can put them into the chat. We might not address them as we're going through our talk per se, but I'm going to start, and then Jason's going to go from there. So again, please, hello, Karen. Hi. So we'll make sure that we answer all your questions as we get to that point. So I'll go first, Jason will go, and then we'd like to kind of close it out with questions is probably how we're going to do it. So without further ado, let me get started. My name is Dr. John Robinson, and I am the co-owner of the Hormone Zone. And this is my beautiful wife, Dr. Christina Romero Bosch. We've been practicing for 19 years, focusing on hormone replacement therapy and helping patients with all kinds of things with their health, but not the least of which is their bone health, as we're working with hormone replacement therapy. We have a podcast called the Longevity Protocol. Please check all of that out. And we have various approaches that we take with the Hormone Zone, whether that is regenerative medicine with tissue regeneration therapy like stem cell therapy, thyroid, that's my personal passion. We do things with regenerative medicine as it relates to the skin and aesthetics, and certainly a lot of sexual wellness. And so you can follow us on Instagram at the Sex Docs. What I'm going to focus on today regarding hormone replacement therapy, and again, something that I've been doing for a long time, there's many different things that I can talk about. There's many different things I could even talk about as it relates to hormones. But what I'm going to talk about today very specifically is hormone replacement therapy using hormone pellets. And I've been using pellets for the past 19 years. There's not many people in the country that have been doing pellets longer than I've been doing pellets. And I think it's really worth talking about. And I'm going to get into the specifics of how hormone pellet therapy relates to bone health and why it generally is one of the most superior ways to put hormone into the system. And I'll talk about that as it relates to bone, and I'll keep really specific to that. Obviously, it does many, many things beyond that. But of course, we're focusing on bone today, something that's not always necessarily the easiest thing. It seems like that it's this specter out there that people feel like they can't figure out. And it isn't the easiest thing in the world, but it's definitely something that is attainable in terms of getting your bone health back. And that's what we'll focus on. So with pellet therapy, really what's important about hormone replacement therapy, maybe you've heard of different forms, maybe you're on different forms, creams, gels, oral forms, patches, even injections, they tend to not keep the hormone levels consistent. And that's really the key when it comes to hormone replacement therapy, it's consistency. So we can see in this slide here that pellets will bring the levels up and they will keep the levels up into the optimal range. And that's what's really, really important when it comes to hormone replacement therapy. And so what are these little pellets? They're small, little, tiny little grains of rice. You can see the schematic here that's showing that we're numbing a little area in the side of the hip, making a small little incision you don't feel, and then placing the pellets underneath the skin. And they just live right there under the skin, right on the side of the hip, and right there in the fatty layer. And they're very small, and but they're very potent and powerful. So you get consistent levels. Again, that's the key. It's highly absorbable. It's really compliant. It's set it and forget it. You know that the hormone levels are going to be there because the little pellets are there doing their job. Again, it takes me 5 minutes to do it. When I'm saying that I've done this thousands of times on thousands of men and women, it is not an exaggeration. So it's really, really simple when somebody knows what they're doing. And the pellets can last up to 6 months. On average, maybe 3 to 4 months for women, maybe about 4 to 5 months for guys. But again, both men and women, it can go up to 6 months. So a really profound way to go about putting hormone in the system for both estrogen and testosterone for men and women, by the way. And as we're talking about osteoporosis, There are men that deal with that, but obviously majority will be women. So the hormone is there consistently helping with your bone. And here's some of the things that it can do. So when we get both estrogen and testosterone in the mix, a lot of times when we're saying hormone replacement therapy, we're not necessarily considering both estrogen and testosterone for women. We're just thinking maybe estrogen only. And estrogen is extremely important. It's inhibiting these cells called osteoclasts, and those are the ones that are sort of breaking down bone. And when they'll just kind of go haywire if estrogen's not there. But testosterone comes in, and that's actually building bone because it's stimulating osteoblastic activities. Little bones are actually little cells that are building bones. So when you get both estrogen and testosterone into the mix, this is when you actually can get better bone health. And so we're always using both. Of course, it's a sustained delivery system. And when you have that continuous flow of hormone, you have that continuous bone protection. It's there for you 24/7. So when you have that continuous estrogen and testosterone is when we see better outcomes for bone health as it relates to hormone replacement therapy. You can see here that a 2 to 8% improvement in bone mineral density scores after being on pellets for a couple of years. And I've had patients now with me for 19 years. I had patients with me that were on pellets before I ever started doing pellets. I've seen them now, over 2 decades of doing pellets consistently. And it really, really helps with their bone mineral density.
So
and of course,
Dr. Robinson, sorry for interrupting here, but many of our clients are asking, I've had cancer, or I've had a history of cancer in my family. Can I still do hormone replacement therapy?
Yeah, the answer is absolutely. That's kind of one of the best questions, especially as of late. Again, doing this for a long time, and when you're working with a bioidentical hormone like the way these pellets are, it does not increase the risk beyond any risk that somebody has sitting in front of me. It doesn't increase the risk of breast cancer. With the Women's Health Initiative that came out in 2002, that kind of started the whole thing. It started the whole scare, really craze about estrogen causing breast cancer. That was the headline back in 2002. And recently, fortunately, there has been a tremendous uptick in debunking the Women's Health Initiative from 2002. Things that I've been saying, I was careful about how I was saying it, was not part of the conversation the way it is now, but in this newer climate of awareness of health and wellness and discussing these things, it has come out, and there's been some real champions out there. Dr. Marie Claire Haver and others have been really championing estrogen for women and hormone replacement therapy for women in general. Yes, they're talking about testosterone too, but definitely saying no, this whole idea of this automatic reflexive thought that estrogen causes breast cancer, really, I don't know how else to better say it. It's just nonsense. It's just wrong. It's crap. It was crap science to begin with. It was a lot of really, it was political. I don't know how else to say it. So now, fast forward 23 years later, we're kind of coming out of the dark ages, so to speak, of all of that. And it's liberating women to be able to feel free to just go ahead and move forward with that. Of course, with someone that knows what they're doing, but nonetheless. So that's my.
But you do that, you know what you're doing. And many of our clients are saying, hey, I've heard about hormone replacement therapy, but I'm just so scared to go on hormones because of maybe they have a risk of cancer. So yes, I hear this time and time again.
Dogma dies hard. Medical dogma, any dogma dies hard, but medical dogma really dies hard. And so there will still be that perpetuated fear that's out there because there's still doctors that are in an antiquated way saying these types of things out there. It's changing.
How do we have conversations with our clients and your clients about hormone replacement therapy and how safe it is for women, especially in their 60s, 70s, and 80s, where many doctors have been telling them that they cannot be on this therapy?
You're saying, how would I say that?
Yeah, how can we have that conversation? And because many people are saying, hey, I just don't even want to enter into the realm of hormone replacement therapy.
Yeah, I would tell them to continue to research, continue to look for the experts that are out there. I mean, now on social media, there's so much more that we've ever seen in terms of availability of information. I'd also say get a book by Dr. Macri called Blind Spots. Blind Spots. And Dr. Macri talks about medical dogma in this book. And there's one particular chapter in there where he specifically goes in and discusses and debunks all those issues with breast cancer and estrogen and all of that. It's actually it's a really cool read, just that one chapter alone. But he goes into many, many things, including the medical dogma of, speaking of this and sort of women, there was the medical dogma that we didn't need to wash our hands. And then there was this crazy guy named Semmelweis, a Hungarian doctor back in the 1800s, who said, "No, wait a second, we're gonna wash our hands before we give birth, help women to give birth." And in his ward, the deaths plummeted, because what the practice was prior to that is that doctors would go in and they would actually do autopsies and work in the cadaver lab and then come without unwashed hands and then help women to deliver babies, and where they were just passing all kinds of infections. And so what happened with Semmelweis, and this is just a prime example of medical dogma, he died in an insane asylum, penniless, because everyone just sort of ostracized him. And now, of course, we all know, wash your hands, duh. But medical dogma dies hard, and it certainly did with good old Semmelweis, and it will probably to some degree with estrogen and breast cancer risk. It's going to die hard, but we have to continue to educate and just be fearless out there and go and find the information, because it is there. It's always been there.
It's also estrogen is so protective of many other biological functions. I think that you can speak to that because you've been doing this for over 19 years.
Yeah, it's far beyond bone, for sure. And it's, disease risk, cardiovascular disease, diabetes, Alzheimer's disease, dementia. These are those kinds of main aging issues for both men and women. And so it's definitely helpful for all of it. But let me move on here.
Sure. Thank you for that.
Sure. So again, back to pellet therapy and bones. This is a little bit of the technical information, but it's definitely talking about the estrogen receptor. And I'm seeing some questions that are kind of coming out about this. The estrogen receptor is there. It's a good thing. And pellets will specifically bind to estrogen receptors for both osteoblasts and osteoclasts in bone. So this is a good thing. It's helping with bone health that way. And that's a good thing about estrogen. Here was something that I didn't even know in my preparation of this and doing some research. It was something I didn't really fully appreciate. But hormone, particularly sustained hormone levels, will trigger something called apoptosis, which is programmed cell death in osteoclasts. So we don't want osteoclasts going crazy. We want to control them. They're there. We need them. It's not, again, an evil in and of itself of osteoclasts, but we don't want them going crazy. So hormone estrogen actually has this ability to make them stay silent through this programmed cell death. Also cytokine modulation here, reducing pro-inflammatory states. That's a big thing. Inflammation equals disease. Disease equals inflammation, especially when we're talking about bone. And decreasing oxidative stress that ultimately in the end also damages bone. So that's just setting up this hormone replacement therapy, setting up the correct milieu or the correct environment for someone to be able to gain bone. Look, this works. I'm a results-driven person, so we're very results-driven for our patients. And if it happens to be for their bone health, we know that we're going to get results with this type of hormone replacement therapy, and particularly with pellets. So you can see here, we're getting, again, this improvement overall with bone mineral density. It's helping with vertebral protection, reducing vertebral fracture risk by up to 60%. Same thing with the hip, wrist. We're really, really reducing overall risk. I mean, it's very well researched and understood at this point. And this is also what's really important. Everything that we do is very synergistic. However we're approaching health, And this is one of the reasons why we're wanting to partner with OsteoStrong, because they already have a synergistic approach with what they're doing. And then we see a synergy with our synergies. So with the hormone zone, I mean, this very symbol that's in front of us here is this idea of pulling together key hormonal systems to be able to help a patient optimally. But pellets in and of themselves, estrogen, testosterone pellets in and of themselves, create a synergy. So they're creating an estrogen and testosterone balance. They're influencing growth hormone, thyroid. Definitely, estrogen in and of itself can influence the pituitary regarding thyroid, and definitely helping blood sugar control and insulin sensitivity. So we're getting improvement with our metabolic rate and those types of things, and metabolism overall. So we always want hormonal synergy, and this is just something that pellets in general do. So as a somewhat of a, as we're kind of summarizing here, another graph that kind of shows this concept that oral forms, creams, gels, it's a low efficacy because it's not keeping the hormone there consistently. So sometimes people are on hormones and they're wondering why it's not helping with their bones. And it might not be helping with their bones because the hormone isn't there consistently in the system. The same thing happens with patches. I will say injections, we do focus on injections as well. It is the two key delivery routes that we focus on, pellets and injections. But historically, injections haven't been done correctly. We do it correctly, but historically it hasn't been. So that's why it's kind of not ranked quite as high as pellets. But I will tell you, for women, if I had to pick, I'm generally picking pellets because of its superior nature of secreting hormone consistently. And you can see here too that, bisphosphonates, not that we are fans of those in general, for sure, and I'm sure Jason will get into that to some degree today, and we can answer to that, but these bisphosphonate medications that people will take, I think they're not just similar, but I think hormone replacement therapy and these types of approaches here with OsteoStrong are far superior to that. But ultimately, in the end, we want those additive effects of bringing it all together. And that's really what this slide here is talking about, one of my final slides here. Again, doing this for a long time, I've helped a lot of people with their bones, but not always. It doesn't always work. And I'm thinking, well, levels are good. I'm doing what I'm doing on my end. But if there's certain things that the patient isn't doing, if maybe I don't have the ability to refer out to the right people that also know how to help with this, then patients aren't necessarily going to do well, even when they're on something superior like hormone replacement therapy, the way we do it in using pellets. So what's one of the key reasons? They're just taking the wrong type and they're not getting the right amount. Dose has a lot to do with this as well. Maybe patients are not getting good results because they just haven't measured what's going on. Maybe they're relying only on a DEXA scan and they're not using something that's more qualitative like a REMS test. Patients definitely are not exercising sometimes. So I can talk about it all day long. If patients aren't doing that, it's not going to help now, but maybe there's reasons why they can't. Maybe they have certain restrictions of why they can't. Maybe the very fact that they have the osteoporosis or osteopenia might be restricting them in what it is that they can and can't do with exercise. And so they need a very specific type of exercise in order to be able to help with their bone health in a safe and effective way. Definitely not getting enough protein. I mean, I'm standing on my head like a monkey all the time trying to emphasize protein.
All day long we talk about protein.
I say it.
The body doesn't heal in a vacuum. And so when you're talking about hormone replacement therapy and what we talk about at OsteoStrong, the pillars of bone health, protein is one of those things. Hormone replacement therapy is another one of those things. And so we really want to try to change the narrative on how we heal a body. So if the gut health doesn't work, if, hormones are not optimized, there are many things within this, what we call the pillars of bone health. If we're not satisfying all of those things, the body doesn't heal. And so to your slide here about protein intake, we suggest 1 gram of protein per pound of body weight. And the reason we do that is because as we age, the body doesn't break down protein as well as it did when we were younger. So we say, hey, 1 gram of protein per pound of body weight is what is ideal to help you regenerate bone tissue, muscle tissue as well.
Sure. Yeah, and that is, I think, even more true with women and women that are over 50 and in menopause. We're seeing these protein requirements are far higher than what we've ever suspected. They're certainly higher than the RDA, which is largely nonsense, or recommend U.S. Recommended daily allowance. It's far beyond that. So I agree with that estimation of roughly 1 gram per pound of body weight, or ideal body weight where somebody's wanting to go. Proper micronutrients, and then probably the biggest thing, and again, this is what's fantastic about OsteoStrong and Jason. Patients don't have a team working towards their ultimate bone health goals, and they aren't looking at these pillars. They're not looking at things synergistically. They're not going to ultimately have the best possible outcomes. And so we all want to get the best possible results. So look at it from a team standpoint, look at it from a synergistic standpoint. I want to let everybody know this is our offer to all new patients that might be listening, or if you have friends that you know, loved ones that you know that are perhaps suffering with hormone deficiencies, and certainly with osteoporosis, to reach out. And this is our gift to you. Some random pictures there of me and my wife. We certainly love to kind of put ourselves out there for all of you. And I've just had a fantastic time just giving this overview. I'm certainly going to really love what Jason's going to have to say here. And then we're going to get to all of these questions. I see they're being peppered here. I absolutely love to see all these questions, and we're going to answer every single one of them. So Jason, sir, I will give it off to you.
All right. Thank you. Jason Brightwell here. I am the owner of the OsteoStrong locations in Scottsdale, Arcadia, and Beverly Hills. I have been let me see if I can share my screen here. I have been a lifelong longevity, I don't want to say guru, but it has been my desire to have a long, healthy life. And I've been working on this since I have been in my 20s. And what I found, and I've done pretty much everything. You name the therapy, I think I've done it. And it wasn't until I was introduced to osteogenic loading and bone health as a modality to get me to that. For me, I want to be 120 years old. That's not for everybody, but I think if I've got a good life and a body that works, why not be around to see all the change that happens, to be with my family, to be able to appreciate and enjoy that life. And so my presentation really is why bone health is a key to health and longevity. So bones matter. Bones are not just the structure that keeps us solid, but they are metabolically active. So from osteocalcin that controls other hormones in the body, to blood cells that help regenerate the body, everything about the bones, from skeletal strength to posture balance, every bit of this matters. And so let me see if I can continue on with this slide. Thank you. And so why do we even care if we have a good skeletal system? And it turns out that 55 million Americans are at risk of osteoporosis in the United States alone. 200 million people across the globe. Now, we tend to only worry about our own neighborhoods. This cost to our communities, it's over $17 billion. 50% of women and 1 in 4 men will suffer from osteoporosis in their lifetime. Now think about that. This is an epidemic at a massive scale. We are seeing people as young as 30 years old having osteoporosis. 50% of all people who have osteoporosis will be disabled for life after a fracture. Now, this is something that you may not know. Falls or accidental deaths, that is the 3rd cause of death in women over 65. So this is actually a really big deal, because when we're 65, we think we have really good lives, we're healthy, we're strong. But when that fracture happens, it changes everything. So this is the life cycle of bone. Most people don't even think about bones, to tell you the truth. Bones are constantly remodeling. From the time we're born till the time we're 30 years old, our bones are remodeling. And it's usually through those impact years from 12 to 18 where we really gain bone strength. But after the age of 30, we begin losing 1 or 2% per year. This is why it matters. Women lose bone density 1 or 2% per year when they give birth. Sometimes it's 2 or 3%, and definitely when they enter those menopause years or perimenopause years, that's when we lose 5 to 8% of our bone density. Men often will lose 1 or 2% per year. It just happens that they're taller beings, they have stronger and bigger bones, and it just usually happens about 10 years later. I don't know if you can see my pointer on the screen, but this is 30-year-old bone here. You can see that the bone and the collagen matrix is thick. It's nice and strong. But as we approach our 50s, 60s, and 70s, we really lose that density and that structure. And most people think bone, the exterior of the bone is really what matters. What matters is the interior, and that is the trabecular bone. That is the microscaffolding of that bone, and it's where true tensile strength occurs. Our bones are supposed to be flexible, but as we age, our body deconditions. And as our bodies decondition, our bone deconditions as well, and those bones become brittle. And when they become brittle, they fracture. So for most people that don't know, I think most people in this webinar probably knows what osteoporosis is. That just means porous bone. So as you can see here, when we're in our 30s and younger, the collagen matrix is strong. And as we begin aging, we begin losing that structure. And then when we get that diagnosis of osteoporosis, look at what the bone looks like. Of course, we're going to have a fracture if this is what the bone looks like. And so normally this is an active slide, but these are osteoblasts. So just so you know, we have osteoblasts that rebuild bone, and we have osteoclasts that take away bone. Bones are constantly remodeling. We get a brand new skeletal system every 7 to 10 years. So it's no surprise that someone tells us, or maybe you heard it from your grandmother or your mother, that they used to be an inch taller, maybe 2 inches taller. But if we're not putting pressure on that frame, our bones will get weaker and weaker. The brain always prioritizes organ function. Organ function is what really matters. That keeps us alive. So if we are not putting pressure on the frame and we are not getting the proper nutrition, which is like number 1, maybe number 2, because gut health is so important. If we're not getting that nutrition into our body, the brain will take those minerals from our bones and move it into the organs so the organs function properly. So we've got osteoblasts that build bone, and we've got osteoclasts that take it away. And as we age, after the age of 30, that osteoclast becomes more active. So why does that matter? So why does it matter that our bones are getting weaker and weaker as we age? Well, it turns out that our bones and muscles are connected, and it is a musculoskeletal chain. And we work out, we're thinking, I'm working out at the gym, I'm getting strong, but yet you can't overcome a plateau. You can't lift more weights than you lifted last year, 2 years ago. And you're like, why can't I do this? I'm at the gym 5 days a week, 3 days a week. Why can I not overcome this plateau? It turns out that the brain will not let the muscles be stronger than the bones can support. So bones are critical. So as our bones decrease in strength, we lose muscle strength. And because of that, we lose our balance and we lose our posture. How many people are kyphotic and they're starting walking with a hunched over spine? How many people have joint and back pain where the ligaments and tendons are just not strong enough to support the spine. And of course, we've got, lower, an increase in blood glucose, which our body cannot metabolically control. And then we have a risk of fall or injury. So this is something that I talk about all the time. And I really, if you don't take away anything else out of this presentation, it's this slide right here. These are the pillars of bone health. This is a master key to improving your overall body function, not just for bone, muscle, cardiovascular health. These are the things that really matter. And so many people, and I came up with this over the last maybe 3 to 5 years when I opened OsteoStrong, and I thought, you know what, this is something that's really going to stimulate bone growth. And I had people not improving. And it really scratched my head. I was like, why are people not, strengthening their body? And what I found out is that people were under eating. Thin is in. Thin has always been in. It's always been important to be in shape, to maintain your physical appearance, but that comes at a cost. When our body requires 2,000 calories, and you have to be honest with yourself, are you actually getting the calories that your body needs? There's easy tests. We have a RIMS ultrasound scan that will do your BMR. You can get BMR probably at any gym. But if you are not eating for what your body requires, you are malnourished. And so I asked them, how are you supposed to build bone or muscle? They're going to the gym, they're trying to build muscle. How are you going to do that if you are malnourished? So nutrition is the key. And so what we tell people, yes, prioritize protein and get your macro and your micronutrients. Fiber is important, good fats are important. But if you don't know how to do this, talk to a nutritionist, someone that can actually guide you so that you're making really good, healthy choices. So then we go into supplementation. Why is this important? If we're not getting the minerals our body needs and our gut isn't breaking it down, our bodies will always pull nutrients from our bones. Because again, the brain prioritizes organ function. And then we talk about gut health, which almost controls everything. That brain and gut health connection is so important. If you're not absorbing the food that you eat, if you have taken a course of antibiotics, if you are on long-term steroids, there are many reasons why your gut health doesn't work properly. It's important to work with a doctor that will do a comprehensive gut health nutrition test and see what's really going on, because it all matters. And then we get to this hormone health, which Dr. Robinson has talked about. He's been working on this for over 19 years. This is something that regulates bone turnover, estrogen, testosterone, growth hormones. When estrogen drops honestly in perimenopause, so they're saying now, 38 years old, this is when you need to start testing what is going on in your hormone health. That brain fog that you feel, that the body changes, you're feeling tired and sluggish, that matters. And that is when you need to find a doctor, someone who is really good with hormone health, to try to analyze what's really going on. You don't want to wait until after menopause just to decide whether or not hormone therapy is right for you. One of the most important things, again, is sleep and recovery. How can your body heal if you cannot recover in sleep? During those first few hours of deep sleep, that's when your bones repair. And if you are one of those warriors that say, hey, I get 4 hours of sleep, or I don't sleep well, or that's just not what happens, that matters. So it's almost one of the most important things that you can do to really improve bone health or even overall body health in your life. Stress and mindful shows up on this list. Would you be shocked to know that over 37% of the American population is dehydrated? So dehydration matters, or hydration matters. Biological functions don't work well when our body is in a dehydrated state. So being able to take in that fluid content, however you're going to get it in, truly matters. Last on our list is really the thing that stimulates all of this. If you're really about bone health, you need the stimulus. And the stimulus is a force that's greater than the activity in your everyday life. And that is what we do here at OsteoStrong, and that is osteogenic loading. It's a mechanical trigger that activates the entire system. When that happens in your body says, whoa, that is a lot of force. That something is triggering our body to stimulate the biological function. So what does it need? It needs nutrition. It needs the supplements. The gut health has to activate all of that together. And the hormones, the estrogen has to be high enough so that those functions process. So I put this on here to let everyone know that these pillars are super important. Nothing happens in a vacuum. This is Michelle. Michelle is one of our superstar clients here at OsteoStrong. She has been with us for over 4 years. So I don't know if you can see this well on the screen, but she started with us in 2021. 2021. In April, her bone density was negative 2.2. And in 2022, she improved her bone density over 5% to that negative 1.9. So that put her into a higher osteopenia range. This data over here, I don't know if my pointer is showing, this is grip strength. Grip strength is so important as we age. And you can see here, she started at I don't even know what the numbers are because I cannot see on my screen. But this trend is moving in an upward range. For most people, every 11-pound drop in grip strength is a metric of how our bodies will, not function as we age. So it's kind of like a metric of longevity. For every 11 pounds of drop, that it decreases the amount of longevity that we're really going to have. Most people want to know about osteogenic loading. What does it do? How does it work? We have an upper growth trigger, a lower growth trigger. We have a core and a posture. This is just a representation of how strong she was over a period of time. And as you can see, she's pretty consistent, especially in years like maybe 2 through 5 and into her like 5th year. I think that's what she was, 4th year. So this metric here, it shows us that you don't have to actually get stronger as you move along. It's all about consistency. Michelle was consistent in her sessions. Over here, we see she was with us for over 201 sessions. Yes, bone density takes time. Anyone that tells you different is not telling you the truth. Most people lose bone density 1% or 2% per year after the age of 30. So most people have been losing bone density for over 20 years. And then they magically want a pill or a supplement to change the trajectory of their bone loss. Michelle, in 4 years, moved her bone density into the normal zone. If you'll see here, she's now negative 0.2. This is an incredible story, and we have seen hundreds of women just like Michelle reverse her bone density over time. Again, I just want to impress upon people, bone density takes time. This slide tells us that osteogenic loading is the spark, but your body needs nutrition, sleep and stress, hydration, hormone health, and gut health. This is the process of bones remodeling. So, exercise. Every single doctor out there tells you that exercise is the way to go. They say weight-bearing activity is what you need to do. But what is the minimum trigger? What causes bone growth? What is that magic number? Can anyone tell me how many? Well, I don't know if you put it in chat. I'd love to see what our 19 people that are in the chat are thinking about. What is the stimulus for bone growth? Is it walking? Is it running? Is it swimming? Pilates, biking? Keep moving. Okay, I see keep moving. Is it plyometrics, Pilates, biking, powerlifting? Anyone? Would you be surprised to know that walking does not improve bone density? This is a meta-analysis in postmenopausal women. And what they found is that there was no positive effect on bone mineral density for people who consistently walked. Weightlifting. Most doctors will tell you you need to do weight-bearing activity. This particular study here in the Bone Mineral Journal tells us that weightlifting in postmenopausal women, there was practically no change in their BMD, even in a population that was highly motivated. Gymnastics. This slide is usually here. I don't see why it's not showing up. However, when people jump off a 4-foot beam and stick their landing at over 12 times their body weight, this is impact. And I think most doctors, any doctor out there on the internet that's talking, whether it's Dr. Doug Lucas, whether it is Dr. Robinson, they're talking about that impact event that is important to stimulate bone growth. Well, what they found here is that gymnasts who triggered osteogenesis after 17 multiples of their body weight. This was significant. Gymnasts after a 12-month follow-up demonstrated higher BMD and had significant bone accrual. Most people can't do this. This is something that most 70 and 80-year-old people are not able to do. So what the literature is telling us is that the intensity of the exercise is really important to stimulate bone growth. So it's not just weight-bearing activity, it's the impact and the intensity. What they tell us is that levels exceeding over 3.9 or 4.2 multiples of our body weight is the trigger for osteogenesis in the body. These are journals that tell us what those methods are. And what those methods are: gymnastics, plyometrics, that's jumping, and powerlifting in the body. Weight-bearing exercises are safe. They don't strengthen the bone. High-impact exercises such as powerlifting and gymnastics or plyometrics, they're not so safe, but they do stimulate bone growth in the body. But what does, and this is what we do here safely at OsteoStrong. So it's safe and it strengthens bone and it's osteogenic loading. This is what we do. So osteogenic loading compared to a gym, this is a leg press that you're doing. You know, this is a 90-degree angle here. You're doing multiple reps, full range of motion, and it's limited to about 1 or 2% or 1 or 2 times, your body weight. Osteogenic loading compared to the gym, it's isolating the joint. So we're putting you into a 120-degree angle. We're allowing you to exert force and compressing yourself into this static space. And if you can see here, this particular woman is able to press over 1,000 pounds of strength. We have 4 different devices. We have an upper, a lower, a core, and a posture. Each one puts you into your biomechanical safe form, allowing you to exert force on the frame. When you hit certain multiples of body weight, osteogenesis safely occurs in the body. This is a once-a-week protocol because bones heal slowly. These are the benefits. I mean, you want to know what safe benefits of osteogenic loading. Not only do we improve bone density. We improve muscular strength through myofibril hypertrophy. Balance is something that happens pretty quickly. We don't want people to fall. So if we're improving people's balance, they tend not to fall and their posture tends to improve. When we improve muscular strength and ligament and tendon strength, the joint and back pain goes away. This is all done in a simple 10-minute session once per week. And I would allow anyone to, if they had any questions, to put those into the chat so that we, Dr. Robinson and myself, can talk about how this particular modality helps you strengthen your body so that you can hike those mountains, do those skiing activities, the things that are really important to you into your 70s and 80s.
Excellent. Can you see the questions here, Jason, on your end?
I can. Someone said something about carbs. There was something about...
Here, I'll just start at the top. I just wanted to make sure you can see them. So yep. I'm going to start here with Karen. She asked, my understanding is that estrogen can feed cancer receptors, but it doesn't cause breast cancer. I think there's a general truth to what she's saying there. In terms of estrogen potentially feeding a certain type of cancer, if it is estrogen receptor positive cancers. But even then, again, we have to start with the premise now, and this is maybe even a newer concept in the sense of getting rid of this dogma that I was talking about earlier. We're still assuming that what was said in 2002 was true when we're saying things like this. And because that became the initial premise, and then everything was sort of built in and around that after 2002, that estrogen causes breast cancer. So I don't necessarily think that even that's true. I would still say that's kind of standard at this moment, that if a woman has breast cancer, that it is possible that she's going to choose not to use estrogen. I can certainly say that the majority of oncologists out there are going to say that without question.
But doesn't estrogen naturally occur in the body?
Of course, yes. And
is it really estrogen that is causing the cancer, or is it something else?
It isn't, because estrogen, because cancer is multifactorial. So they always just usually, in the way we think about things in oncology and just in medicine in general, and at least in Western medicine, is that they're trying to isolate things always down to one causal thing. It's just this one singular thing. We live in a vacuum, so we're going to find this one thing in the vacuum. And they just blame and point a finger at a thing, and that thing in this case often is estrogen. So no, it's cancer is multifactorial.
And doesn't estrogen, like replacement therapy, do so much good or has so many better benefits in the body just over the effects of breast cancer? Like, isn't it protective of so many other things in the body?
And so many other things, and I would even say it's also protective of breast tissue. So, estrogen is an antioxidant. It has all kinds of good things for breast tissue. There's plenty of research that over the years has shown this. In vitro, in vivo, kind of in vitro, like in the dish, meaning like those cell lines and things that they've been able to keep cell lines of breast cells optimized with estrogen, been able to take breast cancer cells and actually use estrogen to fight it. So it's controversial at the very least, but again, we're coming on this premise that estrogen was causing breast cancer in the first place, that we now know that was not increasing the risk, that all of the information from 2002 and largely beyond was wrong. So no, I don't.
It continued that study, right? That particular study continued for many years.
Yes, well, certain aspects of it, they halted many things of it.
Okay.
In 2002, because it was a big sort of like, oh my God, we need to stop.
Yeah, but this is the thing that everybody's scared about, because they heard about that study, but they didn't hear the rest of the story. And I think you might have the rest of the story.
Well, part of the rest of the story is that they kept going back and re-examining the data. So they stopped the study in terms of interventions with patients, but they went back and they kept looking at the data. And the more they kept looking at it, they had to continue to admit, no, it wasn't a problem after a certain amount of period of time, because they were telling women to stop at 5 years but even after that, they were saying that women couldn't start it after not going through menopause for a certain amount of time, which was wrong as well. But no, it's not increasing the risk of breast cancer. It's not taking into account testosterone. Testosterone is highly protective to breasts. There's a brilliant breast surgeon named Dr. Rebecca Glazer. Her website is hormonebalance.org. And she's a breast cancer surgeon who uses testosterone for women with breast cancer. I've been using testosterone for women with breast cancer for 19 years. It's a standard for us that actually helps to decrease mortality rates and having the breast cancer come back just by using testosterone by itself. So yes, there's definitely more to the story. There's always more to the story when it comes to cancer in and of itself. What if someone's, I think she's saying, Karen's saying, what if estrogen dominant? What if you are estrogen dominant? Can you still do estrogen pellet therapy? Estrogen dominance as a diagnosis, I think, is probably not the most accurate diagnosis. I'm not a big fan of that concept of estrogen dominance. It's something that was sort of also started several years ago, and most women are frankly not estrogen dominant. They might have problems with, let's say, digestion or metabolism of their estrogen, and we work with that and helping optimize that for women. A lot of that's through diet and some other things. But no, I don't really think there's a problem with that one way or another. And I have women who've been told they were estrogen dominant. And once I saw labs and we analyzed the entire clinical picture, I promise you they were not estrogen dominant. And it wasn't until they received estrogen in the right amount, in the right way, that they actually started to improve. I've seen that multiple times over the years. So no, I'm not a big fan of that general diagnosis in general. Is progesterone part of your regimen? I still have a uterus. Yes, Francis, absolutely, without question. If you have a uterus, I need to protect it, and we will do that with oral progesterone, and we control that in a certain way. Depending on the patient's age, sometimes women will opt to have their periods actually return, and this depends on the woman and the situation and the age, but we will definitely go out of our way to protect the uterine lining. Is at the top of our priority there if the lining is intact, if the uterus is intact. Do you monitor my hormone levels and adjust to some determined level for bone health? Very good question. Number one, yes, we absolutely monitor your hormone levels in the very, very beginning stages with patients in the several months early on. I say I'm lab work happy. I'm just checking labs left and right. We're very much monitoring what's going on. As far as a predetermined levels specific to bone health, the levels that we are using are optimal functional levels for both estrogen and testosterone. When we maintain those levels, it really doesn't matter what we're talking about, whether it's bone health or brain health or cardiovascular disease or diabetes risk, or just helping with your hot flashes, night sweats, and libido. All of those things are going to be mitigated by the functional ranges that we use and stay consistent with. So I've definitely seen over the years that, I will tell you that for the majority of patients, we used to really monitor the other practice that I was at, this other group that I was at for a long time. We would really monitor DEXA scans, and we just saw them improve so often that it just became most of the time effective with what it is that we were doing. Not all the time, because I knew there was those other things that weren't being done, that certainly those other pillars of bone health that Jason was saying.
Honestly, when you talk about DEXAs and like monitoring how bone health improves, you're having an event coming up, which is a REMS event. REMS is a technology which is ultrasound based. It is 5 times more accurate than DEXA. It's not limited to positioning or the tool itself. This is something that can have the least significant change, which is so important. When we're talking about DEXA, the least significant change is about 4%, sometimes 2 to 4%, depending on the study. So if someone really is moving through their life and you can only get a DEXA every 2 years because the least significant change is 4 years, is that really enough? It's not quick enough to actually monitor the intervention that a doctor is doing with the patient.
Yeah,
So
and
REMS
it's not within
is
that realm of variance, like
yeah, variance. And so like if you decrease 1%, all knows the thing didn't work. But they don't understand. This is a thing that is so important, and I want to impress upon so many people that the least significant change in a DEXA is 4%. So whether you see 1 or 2 or 3% movement in positive or negative range, that is statistically null. It's not enough to tell us what's really going on with your bones. The REMS technology, which is ultrasound based, is again 5 times more accurate than DEXA, and the least significant change is 1%. 1%. So that means that we can monitor the intervention, whether you do hormone replacement therapy or you increase your protein intake. You can see change in as little as 6 months. So this is a really powerful tool for any doctor that wants to see if what they're working on with the client or their gut health, whatever it is really working. 6 months is the recommended cadence of a REM scan if someone is really doing the work.
Yeah, and I think it's important for doctors to make sure that they're constantly trying to improve and they're trying to see what's the next step to be able to help their patients. And I'm always thinking that way. And that was certainly a realization for me with REMS testing, that it could have been that I'm looking at DEXA scans in the past with patients, and in the end, they weren't improving the way I was assuming that they were, or the way their doctors were assuming that they were. So, constantly looking for the best possible route to measure things for patients is really important for me. And I think REMS is right at the top of the list.
Yeah. So we've got 2 things that we want to tell people, I think. One thing for OsteoStrong is that we're having a new member invitation. It's on November 17. It's at our OsteoStrong McCormick Ranch location. This is a wellness event where we're going to talk more in depth about what we do and how we do it. You're going to actually see how we do what we do in the center. You're going to be able to see demonstrations. There's a special gift for anyone that joins, anyone that wants to attend. And if you scan this QR code, you'll be able to sign up for that event. So I'm going to keep this. It's been on the screen for about 5 minutes. So hopefully you have scanned it.
And I'm going to be there. I'll be talking as well, and meeting people. My wife will be there, Dr. Bosch. So it's going to be fantastic. And letting everyone know too, especially any of my patients on here, that we will have this REMS testing available. I think we've already begun the process of sending out emails on that, or we're getting ready to, I think I should say. So we will have that available right at the North Scottsdale location for REMS testing. The OsteoStrong people will be coming by and taking care of all of that for us. And we're going to have that in an ongoing way for patients for REMS testing. Is that it there?
Yeah, this is it.
Here we go.
So Dr. Robinson is for his patients or anyone that wants to have a scan at his facility. You can scan this QR code, go to his site, book that scan. Again, REMS, this is so important. Like a least significant change, 1%. So whatever you're doing out there, if you're really doing good work, we can see the change in 6 months. So this is the power of technology. This is the power of testing. It's more granular. It's more accurate. From machine to machine, from technician to technician, 1%. You don't get that with DEXA. DEXA is 2 to 4%. And so did you really go down? Did you really go up? With DEXA, it's hard to tell. Yeah. This is Dr. Robinson is having an event in his location. Scan this QR code, and you can come to his facility. Our technicians will be there to offer this particular the REM scan.
Absolutely. Really excited about all of that, and excited to be able to share the results with all of my patients, to be able to continue to say, what else can we do here? Our patients.
This is so cool, because now the work that you're doing with hormone therapy, you do a REMS every 6 months to see how, if it's working.
Yeah,
and
right.
Then if there is something that you need to tweak or change, you can do that in as little as 6 months instead of having to wait a year or 2 years.
Yep.
So this is powerful data that you can use in your practice to see and help someone improve more quickly over time.
Yeah.
We've given you the pillars of bone health. We've given you this amazing diagnostic tool. I hope you use them. I hope you join me in our wellness center, November 17th, December 4th for Dr. Robinson. And I think that's probably the end of our time.
Yeah, we're kind of closing out here. I just real quick here, because I just feel compelled. There was just a couple more questions here. Karen said, is testosterone pellet therapy on its own without estrogen and progesterone okay? And can it still be effective on its own? Absolutely. Testosterone by itself can be profound if there's reasons why a woman might not want to do estrogen. So the answer is absolutely yes. Karen says she agrees with the ideal protein targets. However, too much protein can be stored as fat. I think there's some sort of, I understand what
the
you're saying.
recommendations are higher than a gram of protein per pound of body weight. Your body, unless you have kidney issues, then the recommendations are on the conservative side. People could eat far more than that gram of protein. If you want to fuel your body, if you want to actually be strong and make it to 90 or 100 years old, I mean, many of my clients have amazing lives and they just want to be here for their family. You can't do that without a strong skeleton.
Yep, and we'll end on there. Karen asks, does pellet therapy help kickstart the metabolism again for postmenopausal plateau issues? Absolutely, and so does everything that we talked about here. Hormones definitely help to break that plateau, getting the proper nutrition, getting the whole team going, especially with exercise and the right type of exercise. It's going to help all of those plateau issues for you, Karen. I look forward to meeting as many of you as possible. Really want to encourage every single one of my patients to check out OsteoStrong coming on December 4th, our particular REMS bone scan. Make sure you're checking them out. Can't say enough about Jason and Alessandro over there. It's really been fantastic. So
I can't wait to meet Karen. She was a super user in this chat today, and love to meet her in person, and so that she has, we can continue the conversation.
Yeah. Okay. Well, thanks again. And Jason, I'll be seeing you really soon. Alessandro, take care. I know he's on there somewhere, and
I know.
We'll be seeing you all soon.
All right. Bye, everyone. Thank you so much for joining us tonight, and I hope you got something out of this. And I'm here to help. It's a passion and a mission of mine to help people have stronger bones so that they can enjoy the things that they want to do in their 90s.
Amen. All right. Talk to you soon. Thank you.